So Providence Behavioral Health Hospital is a 104-bed hospital, and we begin at the age of 5. We have a child and adolescent unit from ages 5 to 17, and that's an inpatient unit. We have an adult unit, which is 34 beds, and we have a geriatric psychiatry unit, which goes up to age 105. We also do have a detox unit, which is 30 beds and is covered under our Mercy Recovery Services. We do have some outpatient. Our outpatient services are primarily around substance dependence. So we do have, for example, individual counseling services. We have what's called an IOP, which is an intensive outpatient program. And then we have more specialized services, particularly for folks who maybe have had a DUI, who need follow-up care. Well, they primarily come from emergency rooms. Primarily families, loved ones, or patients themselves will present to area, local emergency rooms, and we take folks from Bay-State, from Holyoke Hospital, from Noble, all over the Pioneer Valley. But I have to tell you, we also take patients from Boston, we take patients from Central Massachusetts. Providence Hospital has the only child and adolescent unit west of 495, and so we see children from all over the state. Absolutely, for sure, and unfortunately, the need for detox services and substance dependent services have gone dramatically up in the context of the heroin crisis. Certainly, our child and adolescent services are in demand, particularly since there are so few of these units. And then because of the age of the baby boomers now, we're beginning to see the very desperate need for geriatric psychiatry inpatient services. Most people live with their dementia without incident. It's a very sad disease, and certainly none of us enjoy seeing folks lose their memory, the memories that they've developed over their whole lifetime. But with dementia often comes depression, can come paranoia, suspiciousness, concern that their relatives are stealing from them. These are all very common themes and a common part of the illness. And so those are the kinds of events that we will see folks with dementia for, to try to get that back under some control, relieve the depression, get rid of the suspiciousness, and we're often very successful in doing that. With our other units, adult patients will come to us with a variety of issues. They may have a long history of depression, bipolar disorder, schizophrenia, personality disorders. We do see a fair number of folks now with what we call dual diagnosis, and those are people who have both a substance dependence problem and also a primary mental health issue. So often what we're doing in the hospital is managing medications, but also connecting people to services when they get out of the hospital, so that many service lines, many hospitals have gotten out of the business of mental health care. And it's really to the credit of Sisters of Providence that they've continued to treat our poorest patients oftentimes, our most dispossessed patients, our most disenfranchised patients, our patients who don't have voices or don't have advocates. And so Sisters of Providence has continued to live in the tradition of the original sisters from Canada, who, to me, were the first champions of population health. They would come into communities such as Holyoke, determine what the community needed, and they'd build it. And there was Brightside. The first service line that they developed was an orphanage, because they took the pulse of Holyoke and determined that's what was needed. And so I see Providence as part of the legacy of population health back when that wasn't a word or a term.